discussion, right? So we are asked to talk about what is tricuspid insufficiency. So tricuspid insufficiency, of course, is also known as tricuspid regurgitation. So it's simply what? Blood flows down the tricuspid valve. Okay, so the tricuspid valve is supposed to close and not allow blood to flow back. So the blood should just be flowing one way. Do you understand? But if blood flows down the tricuspid valve and this blood also flows back, that's where you have what? You say that the tricuspid valve is insufficient or is regurgitating, just like a ruminant. All these cows, they eat, they regurgitate, they chew again, then they swallow to the real stomach, So it's just a condition where the tricuspid valve that is between the right atrium and the right ventricle, it does not close properly. So this will now cause blood to leak back into the atrium. As it comes down the right atrium into the right ventricle, it does not close properly, so the pressure can cause some blood to spill back into the right atrium. Okay, so a lot of issues. So in a normal function, the tricuspid valve usually closes to ensure that what? There's just one way flow of blood. Okay, so in insufficiency, the leaflets do not seal properly. So basically, you're having blood flowing back into the atrium. So causes, it could be right ventricle dilation due to pulmonary hypertension. It could be rheumatic heart disease. It could be endocarditis, where there's inflammation of the heart muscles. It could be congenital malformations. It could be carcinoid syndrome, and all of that. Okay, so all of that could basically make your valve to leak out. So symptoms, the person is weak, there's swellings in the leg because there's accumulation of fluid, there's edema, there's pulsations in the neck veins, there's shortness of breath, there's palpitations due to atrial fibrillation. Okay, so diagnosis, you do all those physical examinations and you see that there's a hollow systolic murmur. Okay, echocardiography, electrocardiogram, that's ECGs, to still see how the heart is actually conducting electricity and the rest of it. Then cardiac catheterization. How about the treatment? Most of the times, patients with disease suffer from accumulation of fluid back in the body. So you give diuretics because diuretics will put out fluid more. Okay, the surgical intervention, this is when if the tricuspid valve is not really damaged extensively, you might want to repair. But if the tricuspid valve is damaged too much, you might want to do a tricuspid valve replacement if the issue is actually severe.